all about ortho, as I'm joined by Dr. Andreas Appelt, a German-trained consultant orthopedic surgeon at Al Zahra Hospital, Dubai, with more than 3 decades of experience across orthopedic conditions. Good afternoon, Dr. Andreas.
Good afternoon.
Nice to see you.
Pleasure.
So you're a busy man. We've had to steal you away from clinic for an hour. What's coming into clinic at the minute? What are you seeing a lot of?
Well, we can see all kind of orthopedic trouble and problems, old and young. Here in Dubai we have a young population, so more the young people, a lot of headache, neck pain, lower back pain, knee problems, shoulder problems, hip problems, even feet and ankle problems.
So everything.
Traumas, and we have to treat also the dramatic traumas, fractures and all this stuff.
Things that would come in from the A&E department downstairs.
Exactly.
When you said headaches, it was interesting that was the first thing that you said, because I suffer from migraines occasionally, but I think that's a leap for some people. You know, you go to the GP, you have migraines, they might give medication, but how could an orthopedic doctor or surgeon help with headaches and migraines? I'm
also a chiropractor, so I do the chiropractic you need to know in Germany we are only the orthopedics are allowed to do chiropractic manipulation. So for that it's unique that a doctor or an orthopedic doctor is the chiropractic, but I'm somebody doing that. And sometimes patients are coming having a long history with the headache, and they are looking for some help even from the orthopedics, having a lot of screenings before, and at the end they are coming to me and we can do something. It's not always successful, but if we release the neck muscles, if we release the atlas joints, this might be very helpful.
Now I need to ask this. What is the difference between a chiropractor and osteopath?
It's a chiropractic
and a physio. Let's just get it all in there, Dr. Appelt.
Chiropractic is something coming from Germany and this part of the world. Osteopath is coming from the United States and the British part. At the end, it's coming to the same result. The osteopaths are also dealing with the muscles. You can say now it's a mix of all these things. It's a different type of education, but it comes to the same result. Physiotherapy is something different. So the physiotherapist is not a doctor. Here in this part of the world, the chiropractors are mostly not doctors. The osteopath is also not a doctor. Some are, but most of them are not doctors. The physiotherapist is a specific education, and so these are 3 different things. You can say in a short way the osteopathy and the chiropractic are doing nearly the same.
Okay, that does help. Question here, asking, Doctor, is acupuncture really effective for tennis elbow? If you want to have your questions answered, do send in 4001 or on the app. So Dr. Andreas, is acupuncture really effective for tennis elbow? What is tennis elbow, first of all?
Tennis elbow is a very good question. Thank you for that. You need to know that tennis elbow is a nickname for a problem. It's very, very common, and it's an overstress of tendons. And these tendons are all coming down to the fingers. So it's the finger movements giving you this trouble.
So the pain would shoot up from your fingers into your elbow? Exactly.
And most of the patients are not affected from playing tennis. They are affected from computer typing.
So it's not as active as it sounds then.
Exactly. So the major treatment for that is rule out the problem for the overstress of the finger movements. That's number 1. And to release the pain, it depends. Acupuncture, it might be helpful. I'm also doing acupuncture, but not here in Dubai. It's a different story. For some reasons, the acupuncture might be very, very helpful and effective. It is also possible to treat that with other treatment options like injections. I don't like the injections too much. We have very good evidence with radial shockwave therapy. This is an effective treatment, very popular in Germany, not as popular here in Dubai.
Never heard of it. So how does that work, and what do people expect when they come for a shockwave therapy treatment?
Shockwave is a horrible word for a simple thing.
Yeah, it does sound quite frightening.
It is only ultrasound impulses, so mechanical impulses on certain spots. And we can use that on these very painful triggers for example, on the tennis elbow.
Okay.
And it will release the pain. It's maybe not done with one session. You need 3 or 5 sessions to get it done, but it might be very helpful and effective.
Okay, so acupuncture could well be quite useful.
Absolutely.
Okay, any questions for Dr. Andreas, please do get in touch, 4001, or get in touch via the dubaiEye Messenger app for completely free. We are here until 2 o'clock this afternoon. Anything related to ortho conditions all over the body, literally from head to toe. Question here on supplements. Someone asking, does taking glucosamine, am I saying it right, make a difference to your bone health? Any recommendations for dosages? What is this supplement?
So first of all, this question is a mix of different problems. Glucosamine is very helpful and might be effective, but for another thing, for osteoarthritis. Osteoarthritis is a problem of a joint with the cartilage. So it's a loss or a defect on the cartilage, and you need to know that some important part of the cartilage is made from glucosamine. So it might be effective to treat cartilage problems. In this question, they are asking for bone health, so it's a different story. Bone health is something like everybody heard about osteoporosis and these problems of the bone strength and the bone quality. First of all, you need to know the number one treatment is physical activities. You will strengthen up the muscles, which affects then the benefit for the bones, even for the joints. And number 2 is nutrition. So we know that a very balanced nutrition can affect very good benefits for the joints as well for the bone quality. And supplements like glucosamine is a big market. I don't believe too much because we have to be very careful. There's not a high evidence from the scientific part of these glucosamine drugs and supplements. I know many people like that, but you have to see if you only take the supplements, not doing the first line, which is the activity, it might be not helpful. So
and when you say activity, you're talking about kind of weight-bearing exercise that can really help with bone density, or any kind of activity?
You need to know that osteoporosis and a bad bone quality is not a bone issue. It's a full body problem. And we know more that the muscle and the muscle quality is number one. So if we have a good effect for our muscle activities, which will affect a better bone quality, this is number one, absolutely. So I'm always telling my patients, my job, doctor's job, is to stop pain and problems, that the patient is coming back to the sport activities.
Okay, but if you are suffering from osteoarthritis, this can be a useful supplement, but under the guidance of a doctor.
Absolutely.
Lots of questions coming in for Dr. Andreas. One on the topic of migraine, saying, hi doctor, I've been suffering from migraines for more than 7 years now, and the frequency is approximately 1 per week. Oh, it's awful. The only medication which helps is Sumatriptan. I'm sure you know, doctor. Please give me some advice. Kind regards, Matthew. 1 per week, a migraine must be so debilitating and so frustrating. Perhaps any advice there, Dr. Andreas?
Migraine is not my specialty because I'm not a neurologist, I'm an orthopedic. But as I told, all the problems we have in our human body are symptoms, and we have to look. There is sometimes a big background. So migraines can also be caused by some emotional problems, bad position while sitting, having stress, not doing any physical activities, not drinking enough. All that needs to be ruled out. And definitely before seeing an orthopedic like me, the patient needs to be well screened from a neurologist which is specialized on the migraine. So it needs to be ruled out that there is a major problem inside the cranium, and if this is all fine, then it might be helpful also to see an orthopedic.
Okay, so an MRI would be recommended by neurologist often, or what would be the next step, do you think?
You know, MRI is not always the first step. I know in this part of the world the MRI is always number one, but it's not really needed in every case. So to see the patient, to see the symptoms, and then according to the symptoms do the right next steps might be the first thing, and not the MRI as a rule.
Okay. A message here from Abir saying, my daughter, age 14 months, has started walking and I've noticed her ankles turning in. Will this self-correct? Do you treat babies and infants and toddlers, Dr. Andreas?
Definitively. This is a very good question because this is our daily job. We have a lot of kids, even adults, having these feet and ankle problems. And the name of this problem for the 14-month-old girl is called tiptoeing. That means this girl is not walking properly. She is suffering for more stability for the walking. And this is the big sign for having some so-called subtalar instability, means in the nickname flat feet. So we have to check, is this child flat-feeted? The treatment for 14 months is very simple. Good quality shoes. I know this is the problem of this part of the world. It's a hot country and many like to have the open shoes or just walking barefoot. But for 14 months I suggest look for good quality shoes, means very stiff, very rigid.
Sturdy.
And maybe with an arch support. We are doing custom-made orthotics, but it starts probably in the age of 4 years.
Okay, so in terms of treatment, don't worry about actual treatment until later on, but you could be using some strong footwear in the meantime. Dr. Andreas is here, consultant orthopedic surgeon Al Zahra at Dubai, here to answer any of your ortho questions. We've got lots coming in, 4001 if you'd like to have your question or concern addressed. We're live until 2 o'clock. We're joined by Andreas Appelt, doctor at the Al Zahra Hospital in Dubai, German trade consultant, orthopedic surgeon with more than 30 years of experience, answering all sorts of questions this afternoon, and we've got lots coming in on the text line. If you'd like to add yours, feel 4001 or get in touch using dubaiEye Messenger app, or you can give us a call, which is exactly what Sneha has done. Good afternoon.
Good afternoon, Helen. Hi.
Hi. Now, we've got Dr. Andreas here. Can you tell us some lower back problems you're having? Is that right?
Yes, I do have a lower back problem, and I'm going to be 40 in a year, and I was wondering if it was safe for me to have a second child. I'm always worried that it's not going to go well, and it could harm me, and I could be crippled. These are my fears.
How old is your first child?
He is 8 now.
And did you have any problems in your first pregnancy?
No, I didn't. I had a normal delivery. I had no problems at all. But it was when he was 3 years old, I was diagnosed with a lower back problem. The L4, L5, the space had shrunk, and ever since I've been extremely careful and little worried whether I'm capable of having another child.
Okay, Dr. Andreas, any questions on this topic?
Thank you for this question. First of all, you need to know lower back pain is not a diagnosis. So we need to mention what is the reason for that. And even if you have some changes on your disc, that doesn't mean that the disc change is giving you the pain. First of all, you need to know in Germany, I'm trained in Germany,
right.
All the female after pregnancy, after delivery, 6 weeks after delivery, they start to do specific physiotherapy for the pelvic floor. So first of all, make sure that this was done. If not, go ahead and do some specific physiotherapy for the pelvic floor balance, which might be very, very helpful for you.
Right, doctor. No, I haven't had that, so I think that's something I should look into then.
You need to do that. And second is, from my point of view, I cannot give you the answer, is it fine for you to have the second pregnancy? Most probably, yes. Most probably, I don't see limitations on that in my daily practice, but we have to see the patient, we have to see is there a major problem. You told about the disc issues. We need to see that. Please keep in mind 99% of all the people without problems, they have disc issues, they have some disc problems. If you do an MRI for them, they will have changes on the disc, which is our nature. So this might be not the problem at all.
I hope that helps, and go forth with confidence, but it sounds like going to see a women's specialist and physio might be the first port of call, addressing that pelvic floor and dealing with that back pain. Thank you for joining us. I hope that helped.
Thank you, Helen. Thank you, doctor.
You're welcome.
Lots of text coming in for Dr. Andreas, orthopedic surgeon and consultant. One here from Vertica saying, hello doctor, my daughter is 12, has flat feet and a navicular bone projection in her right foot. Last few days she's been complaining of pain in her left heel. Not sure if this is related. Would like to know, what can we do to relieve the current pain? What care should we take regarding the navicular bone and flat foot? Are there specialised shoes for this condition? And will chiropractic intervention help?
That's a good question. The answer for that is very simple. The overpronation of the navicular bone is only related to the flat feet. That means that the middle foot arch is totally collapsing. But the background for this middle foot arch collapse is an instability of the back foot. So we know that the subtalar joint of the ankle is the initial problem, giving then the collapse on the arch. So that means look for the good quality shoes and look for customized orthotics, not from the pharmacy, not something you are buying without any relation to the individual. So you have to do a measurement, a customized measurement, and then very strong and individual inner soles in the shoes. That might be very helpful. Your daughter is 12 years. That means in that age it starts to develop also some other problems, not even the heel problems, sometimes knee problems or hip, even spinal problems can be related to this disbalance on the ankles and on the feet.
If she was to start using the custom orthotics in her shoes, is that for life, or is it once it's corrected you can then go back to taking them out?
To be honest, you need it most probably lifelong, but do it clever. This is what I'm telling in my daily practice. So that doesn't mean you have to use it 24 hours 7. You can use it if you have a long day on your feet. You can use it for the sport activities. If you're sitting at home, you don't need to use the shoes with the proper inner soles. But you need to understand the background of the problem is always an instability. So you need to get and you need to achieve stabilization to have a normal alignment for your feet, for the knees and for the full leg.
And to do with relieving the current pain for a 12-year-old, any recommendations there, doctor?
So if the inner soles procedure will take some time to get it done. First of all, it's custom made, so this needs time, and even to get used to it takes more than 4 to 6 weeks time. If the pain is unbearable, it's a very good option even for children to do the Radial Shockwave therapy, which is simple ultrasound. It doesn't have any side effects, so this is highly recommended for kids in that age.
And last question, will chiropractic intervention help?
I do the chiropractic, but not on this problem. The chiropractic might be helpful for the middle foot, but not for the heel pain.
Okay, I hope that helps, Vertica. Question here saying, please ask the doctor about fibromyalgia. Is it a real diagnosis?
This is a very good question, and we have 50% of the orthopedic doctors giving the answer yes and 50% no. I'm one of the second part. From my point of view, there is no real diagnosis. I'm always telling this is a trigger point pain on certain spots on the body, and this is always related to some spinal issues. Is it on the neck? Is it on the lower back? By the way, the neck and the lower back problems are always connected.
Okay, I hope that helps. We've got Dr. Andreas Appelt here answering your questions. Lots and lots coming in on 4001. When we come back, we'll be talking about carpal tunnel. We've got newborn problems, shoulders, knees, and growing pains. Stay with us. We're talking about health this afternoon here on Dubai Today. It's all about orthos, and we are here with Dr. Andreas Appelt, a German trade consultant orthopedic surgeon who is down there at Al Zahra Hospital in Dubai. He's got more than 30 years experience. We're very lucky to have him talking about literally everything. We've had all sorts of topics, and if you would like to have your question answered or want to make a comment or just have a concern addressed, 4001 on the text line, or you can send us a message on the dubaiEye Messenger app, or you can give us a call. And we've actually got someone joining us right now. Charlie, is that you?
Yes.
Hi Charlie, how are you?
Hi.
I understand you have a new baby.
Yes, we've just had a son about 9 weeks. He's closing in on 9 weeks by the end of this week.
Congratulations.
Yeah, thank you.
Is he your first?
No, he's the second one. He's got an older sister, who's just about 2.5.
And how can we help this afternoon? Dr. Andreas is here.
Yeah, so me and my wife have been noticing that he's got not a problem as such, but a little bit of an inclination to arc his neck backward, basically look up most of the time, his chin up most of the time, right? So it's not like he doesn't have a problem keeping his head on, we always support his back and his neck whenever picking him up or any of that, but it just seems he's more inclined to, we were just wondering if there was any reason for us to go in for a consultation for this. It's essentially his neck is arched where his chin is up most of the time. He prefers that position. We were just wondering if there's any reason for concern here.
Thank you for the question. So first of all, it's difficult to give you a right advice on that. Might be, or it's possible that this is a problem on the muscles, on the neck muscles, on the scalenus muscles. We call that for the infants, for the small babies, spastic torticollis. But it's a clinical sign, so we have to see that. We have to feel the tension on the muscles, and there is a treatment option for that. The best advice for you in the moment is to see your pediatrician. The pediatric specialist might be the number one, and if he can see, this is a case of a spastic torticollis, he can send then to some centers. They are doing specific treatments for that. You can give an injection in the muscle to release this spasm. If everything is fine on the muscles, then there's also an option to give some traction on the neck. But it's not chiropractic. So for the infants, you shouldn't do any chiropractic. It's just to give some traction to release these area.
So first protocol, we go back to a pediatrician so they can see that action, that position in real life, but you don't think this would be an ortho issue?
Might be, we have to see, but it's a clinical sign. You have to see it first. You have to feel the situation on the muscle spasm. So
Charlie, get into the doctors. Hope that helps, and congratulations again to the family.
All right, thank you.
Cheers.
Thank you, doctor.
Yeah. Thank you.
Bye-bye.
Okay.
Lots of questions coming in. Melvin asking Dr. Andreas, I sprained my right knee a few months ago while I squatted and rose up. He says there was a definite creak. It's stiff and pains when I fold the knee for a long period. What's the best way to treat this? Physio, chiro, or something else?
So first of all, this is a very important question because it brings me always to my main topic. Before doing a treatment, you have to do the correct screening. You need to know what it is. So if there's a sprain on the knee, might be some problem on the meniscus, might be some problem on the ligaments. And for that, you need to see the doctor, you need to see the specialist, the orthopedic specialist, to make sure that on the ligaments and on the meniscus, everything is fine. It sounds it's not fine. If the knee joint is stiff, something is really wrong. And according to the clinical signs, then you can decide to do further screenings like an X-ray. Sometimes an X-ray is not needed, or you have to do an MRI. Before doing all these, I have to highlight the MRI is not the first step. The first step is to see the specialist and do the clinical investigation.
Hope that helps, and all the best with your knee. I think we've all been there, Melville. Now, a question just very quickly asking, any advice for carpal tunnel syndrome, Dr. Andreas?
That's all a big topic. Carpal tunnel, I remember the time 10 and 20 years back, it was really very popular to do surgeries on the carpal tunnel. Now it's hard to remind myself when I did the last time the surgery for the carpal tunnel. It's a big option for the conservative treatments, and you need to rule out first, is it a simple problem directly on the carpal tunnel, on the hand, on the wrist, or is it something which radiates down the arm? So are there some other symptoms on the elbow, on the shoulder, on the neck? If this is the case, most probably this is not a real carpal tunnel problem. It's only the symptom for the carpal tunnel. What means carpal tunnel? It's an impingement on the nerve in the area of the wrist, which affects then some dysfunction and numbness on the fingers and on the hand. And it might be a problem from some impact from outside. It might be also a problem coming from the neck. So this needs to be ruled out first. And if you can see it might be an impact and an impingement, an entrapment on the nerve, then the next step is to do a nerve conduction test, sort out is the nerve really affected in the normal function, and then you can act. The surgery most probably is not needed, sometimes only in 1% of the cases.
Okay, hope that helps. And a message now from Maria. We're talking about the shockwave therapy. She's asking, would shockwave therapy be indicated for a 9-year-old child with constant tiptoeing, flat foot, whose tendons are tight but not short? We've been using special insoles and good shoes, but the problem still persists, and we're being offered splints, but not any other solutions.
Radial shockwave therapy is only a treatment to stop pain. So it is not something to change the position or the alignment on the legs, and it's not able to achieve stability. So for that, you have to see first the specialist, you have to see what is the situation. And again, radial shockwave therapy is for pain relief. So it's only to reduce the symptoms, but it's not to achieve any stability.
So it's not treating the actual problem as such, it's used in conjunction with other treatments. Message here asking, hi doc, is there such a thing as growing pain? My 12-year-old boy has terrible pain in his shins and heels at night time. I had quite bad growing pains. I got quite tall quite quickly, and I was always made to feel like I was imagining it. Are growing pains real?
That's very popular question, and my answer for that is always the same. I don't think it's existing to have growing pain. So this is always something different. It might be maybe a problem with the disalignment, maybe again a flat feet problem, and shin splint pain is kind of tendinitis on the lower legs and on the limbs. So that means optimize the shoes, optimize the walking, look for the flat feet, treat the flat feet properly. This is the number one treatment. I hate the word growing pain because this means the doctor or somebody else don't have any idea what it is.
So it's a bit of a lazy catch-all sometimes. Okay. Hasnain's been in touch saying, hi, I'm a 45-year-old male working for 20 years, sitting in front of a screen for 12 hours a day. Don't think you're alone in that. It's the way of many of us these days. I suspect this is the cause of regular neck and shoulder pain, sometimes leading to long-running headaches. Please advise on some suitable therapy. Thank you.
That's our life. So this is civilization. I cannot change your job, but we need to mention we are human beings. So sitting long days in the office is of course not helpful, but you can have some treatment. You need to treat yourself. Means proper sport activities, proper stretching to release these muscles. One other thing, to have some neck issues, some shoulder issues might be also some part of an emotional problem. So you are carrying the stress for the daily stress on your shoulders, on your neck, and this can also affect some trouble. So it's not only the computer work and the posture of your daily doings, it's the mixture of our life. I'm speaking of the lifestyle. So you need to take care for your lifestyle, and you need to find the good mix of doing your job and doing some exercises, some training. Training and exercises is needed on a daily basis.
It's easier said than done if you've been at your computer for 12 hours. Sometimes you just want to go home and watch some TV. So I sympathise, Hasnain, I really do. But during that day, you could be getting up and doing some more stretching to break up those long periods of sitting.
But definitely if you can do it, and I advise always do it in the morning. So don't do it in the evening. Start the day doing your physical activities and then start working.
That's better. Done. Let me read you this question. You can answer it when we come back. This is from Emma saying, hello, I have constant pain in one of my shoulders. It's been going on for years. I had physio and other treatments, but nothing helped. I finally got it scanned and was told I have the beginnings of arthritis and tendinitis in it. Nothing helps. Do you have any suggestions, please? I'm joined this afternoon by Dr. Andreas, consultant orthopedic surgeon at Al Zahra in Dubai, here to answer any of your questions. It's your last chance to get them in. We're here live until 2 o'clock this afternoon, 4001 on the text line, or you can drop us a little message on the dubaiEye Messenger app, or even give us a call, 04-423 1010. When we come back, we're talking shoulder pain. Stay with us. I'm Helen Farmer, and I'm joined in the studio this afternoon by Dr. Andreas Appelt. He is a German-trained consultant orthopedic surgeon who's working now at Al Zahra Hospital in Dubai. I've had a message here for you, Dr. Andreas, saying, Dr. Andreas is excellent. Had a labral tear in my left shoulder 2 years ago, and he did minimally invasive surgery. I was back to normal in short order. Thank you, doctor.
Thank you very much.
Oh, it's nice to get a bit of a fan message on the text line. It's your last chance to get any messages in, 4001, or via the dubaiEye app. We've got lots actually to come in to try and address. You're also welcome to give us a call. Now, customer, I understand you've got a question about your 86-year-old father. How can we help?
Yes, hi, Doc. Great show, by the way.
Thank you.
My question is, my father has what's been called bone-to-bone on both his knees, and he can barely walk. He's on pain medication and so forth, but we've been advised that surgery is his best option. Anything better than surgery, or is there a less invasive surgery than a knee replacement?
That's a very difficult question, or I can give you not the full successful answer. First of all, bone-to-bone means there's no cartilage at all. That's a high advanced osteoarthritis on the knee joints. And it depends, how is the life quality? I know a lot of people, not patients, just people having this situation without any complaints. So then you don't need to do a surgery. It depends. If the life quality is bad, means he's under pain medication, he cannot sleep properly in the night, and he stops walking, then there is a good advice to do the surgery. Alternative to the surgery, there's the option with some knee braces. So you can try with some knee braces. It depends. Is the situation like a figure of O for the legs, means this is a varus osteoarthritis, or is it a figure of X, which is a valgus osteoarthritis? The valgus osteoarthritis is highly unstable. Varus is mostly stable, and the people and the patient can tolerate the situation. So it depends. You can try. The surgery is only needed if the life quality is really affected.
Does that help, customer? How is your father getting on in terms of pain and quality of life?
He can barely walk. He can barely walk. He's in a lot of pain.
See, the situation is very popular for older people. They are getting more old, more sick, having this situation. So maybe it's a good idea to do the surgery, but it depends. And if the patient is happy just to walk a bit and he doesn't need to have regular pain medication, then you can wait.
And
is there sorry?
No, I was just going to ask what recovery was like, Dr. Andreas, from a surgery such as that.
It depends. Here it's very popular to do the surgery on both sides in one step. That recovery time is quite a bit longer. If you do it step by step, means one side, and after 3 to 6 months the other side, then it's a bit quicker for the recovery. The purpose to do the surgery is to bring him back to walking. He needs to start walking next day after the procedure, and he can step full weight on it.
Okay.
Does that help, customer?
Yeah, it does. But I just one more thing. They told us that he doesn't have to do a full replacement. It's like a plastic sheet or something that they can put between the two bones.
No.
That would help him a lot. Is that something that's a good option?
It is the same thing. So you do total knee replacement. That means you are doing a resurfacing for the missing cartilage. And if you do that only unilateral, means on the inner side on the knee or on the outside, or if you do this bilateral, means on both sides, medial and lateral, doesn't make a big difference in the outcome of the surgery. So that depends to the individual situation. You have to see the X-ray images to give you a good advice.
Okay, great. Thank you very much.
Thanks,
welcome.
Cosmo. All the best to your dad. Now, we messaged earlier about shoulder pain. Let me just get to this really quickly, and then I've got one question that I need to ask you before I let you escape back to the clinic. Emma messaged going, hello, I have constant pain in one of my shoulders. It's been going on for years. I had physio and other treatments and nothing helped. I finally got it scanned and was told I had the beginnings of arthritis and tendinitis in it. Nothing helps. Do you have any suggestions, please?
First of all, we need to make sure, is the pain caused by the osteoarthritis? I have my doubt because we are not walking on our hands. So an arthritis in the shoulder is mostly different than an arthritis in, for example, in the knee joint as the last case. Most probably this shoulder problem is a muscle problem. You have to see, is there a muscle spasm? How is the range of movements on the shoulder joint? Is it related to the neck? You can have a big number of conservative treatment options, not only physiotherapy. You can give injections, which I don't like too much. You can do the Radial Shockwave therapy, which is my favorite because it has no side effects, and you can have a very good benefit on multiple spots on the shoulder joint. So I have my doubt that this is caused by an osteoarthritis, but you need to see the images, you need to see some x-ray images to give some further advice.
Okay. Now, I promise it wasn't me that sent this message in. This was Suresh. She said, and my husband does this, which was why I need to get this answer from you. Suresh says, my wife cracks her knuckles and I hate it. What makes a noise and is it harmful? Are there some people who are able to do this more than others?
Definitely, if it's very popular. And it's really, really harmful. That means, this noise means it's a vacuum effect. So you have a vacuum crack and noise from the joints. It doesn't make any harm for your body. Sometimes I understand the parents, if they are shouting the kids, don't crackle, don't do these noises.
So have I got an argument against my husband doing this, or is it just plain annoying?
To be honest with you, you don't have an argument.
Oh, no. Well, you're not coming back on the show. Dr. Andreas Appelt, consultant orthopedic surgeon at Al Zahra Hospital in Dubai. Thank you so much for coming on. Thank you, everyone, sent in your message. I'm so sorry we didn't get time for all of them. It just goes to show that we do need to have you back on Eye on Health soon.